Which fat-soluble vitamin's active hormonal form is 1,25-dihydroxycholcalciferol? A. Vitamin D. B. Vitamin A. C. Vitamin K. D. Vitamin E. The correct answer is vitamin D. Calcitriol 1,25-dihydroxyvitamin D is the active form produced by hydroxylation in the liver then the kidney. It regulates calcium and phosphate homeostasis. Which is an effective integrated pest management IPM practice? A. Denying pests food, water, and shelter and sealing entry points. B. Leaving food out overnight. C. Ignoring cracks in walls. D. Storing garbage indoors uncovered in the majority of situations. The correct answer is denying pests food, water, and shelter and sealing entry points. IPM emphasizes prevention, sanitation, sealing entry points, proper storage, and eliminating food odor harborage with professional pest control as needed. Which vitamin, in its deficiency, produces angular stomatitis, cheilosis, and a magenta tongue, and is a precursor to FAD and FMN? A. Riboflavin. B. Niacin. C. Folate. D. Vitamin B12. The correct answer is riboflavin. Riboflavin B2 forms FAD and FMN for redox reactions. Deficiency riboflavinosis causes cheilosis, angular stomatitis, and glossitis. Which nutrient deficiency should be considered in a patient with chronic alcohol use presenting with heart failure and edema? A. Thiamine wet beriberi. B. Vitamin C. C. Biotin. D. Vitamin K. The correct answer is thiamine wet beriberi. Thiamine deficiency can cause high output heart failure with edema wet beriberi. Chronic alcohol use is a major risk factor and warrants thiamine repletion. A needs assessment for a new employee training program identifies A. The gap between current and desired knowledge or skills. B. The marketing budget according to older definitions. C. The menu cycle. D. The vendor list. The correct answer is the gap between current and desired knowledge or skills. A training needs assessment defines the gap between current and required competencies, focusing training resources where they are needed most. Which is the recommended approach for a patient with newly diagnosed lactose intolerance who is anxious about nutrition? A. Reassure and educate on tolerance thresholds, lactase products, and calcium sources. B. Recommend eliminating all dairy and calcium when the condition is first identified. C. Tell them nothing can be done. D. Recommend large milk doses immediately. The correct answer is reassure and educate on tolerance thresholds, lactase products, and calcium sources. Education reassures patients that most tolerate small amounts of lactose, especially with meals, and provide strategies lactase enzymes, lactose-free products, alternative calcium sources. An older adult at nutritional risk is best screened initially with which validated tool? A. Mini nutritional assessment. B. Glasgow Coma Scale. C. Braden Scale. D. Framingham Risk Score. The correct answer is Mini Nutritional Assessment. The Mini Nutritional Assessment (MNA) is validated to screen and assess malnutrition risk in older adults. The Braden scale assesses pressure injury risk. For a patient's LDL cholesterol goal, therapeutic lifestyle changes emphasize reducing A. Saturated fat and dietary cholesterol while increasing soluble fiber. B. Total fiber intake. C. Fruit and vegetable intake according to older definitions. D. Physical activity. The correct answer is saturated fat and dietary cholesterol while increasing soluble fiber. Lowering saturate trans fat, adding soluble fiber and plant sterols, weight management, and activity are core lifestyle strategies to reduce LDL cholesterol. Which is the recommended approach for a patient with an unintentional weight gain related to a new medication? A. Review the medication and provide supportive, individualized lifestyle strategies. B. Blame the patient. C. Recommend a crash diet. D. Ignore the medication effect when the condition is first identified. The correct answer is review the medication and provide supportive, individualized lifestyle strategies. Some medications, certain antipsychotics, steroids, insulin promote weight gain. Care includes coordinating with the prescriber and supportive nutrition and activity strategies. Which of the following is the primary reason that vitamin D is sometimes classified as a hormone rather than a vitamin? A. Its active form is synthesized in the body and acts on distant target tissues. B. It is required only in the diet when the condition is first identified. C. It has no receptor in the body. D. It is water-soluble. The correct answer is, its active form is synthesized in the body and acts on distant target tissues. Skin can synthesize vitamin D from sunlight, and calcitriol binds nuclear receptors to regulate gene expression in target tissues, behaving like a steroid hormone. During exercise lasting longer than 60-90 minutes, carbohydrate intake of about how much per hour is recommended? A. 30 to 60 grams per hour. B. 0 grams per hour. C. 150 grams per hour. D. 5 grams per hour. The correct answer is 30 to 60 grams per hour. Consuming 30-60 g carbohydrate per hour during prolonged exercise maintains blood glucose and delays fatigue, up to 90 GHR with mixed sources for very long events. Which of the following describes the term incidence in epidemiology? A. The number of new cases arising in a population over a defined period. B. The total number of existing cases at one time. C. The proportion of the population that is exposed in typical situations. D. The ratio of deaths to total cases. The correct answer is the number of new cases arising in a population over a defined period. Incidence measures new cases over time risk or rate. Prevalence counts all existing cases at a point in time. A patient with Wilson disease should limit dietary intake of which mineral? A. Copper. B. Iron. C. Zinc. D. Calcium. The correct answer is copper. Wilson disease causes toxic copper accumulation. Patients avoid high copper foods, liver, shellfish, nuts, chocolate, and take chelation or zinc therapy. Which is the recommended approach for a patient transitioning from tube feeding back to an oral diet? A. Gradually increase oral intake while tapering tube feeding as intake becomes adequate. B. Stop tube feeding abruptly with no oral intake according to older definitions. C. Continue full tube feeding indefinitely. D. Provide only clear liquids orally. The correct answer is gradually increase oral intake while tapering tube feeding as intake becomes adequate. Weaning enteral nutrition involves gradually increasing oral intake, monitoring adequacy, often shifting to nocturnal feeds, and discontinuing tube feeding once oral intake meets needs. Which is the recommended approach for a patient with type 2 diabetes and Ramadan fasting who is at high risk of hypoglycemia? A. Provide pre-Ramadan medical assessment and individualized medication and meal planning. B. Tell them fasting is forbidden. C. Recommend no changes. D. Advise skipping the pre-dawn meal according to older definitions. The correct answer is provide pre-Ramadan medical assessment and individualized medication and meal planning. High-risk patients receive pre-Ramadan risk stratification, medication adjustment, balanced suhoor and iftar meal planning, hydration guidance, and glucose monitoring to fast more safely. An advantage of electronic health records for nutrition documentation is A. Improved communication, legibility, and data retrieval across the care team. B. Reduced access to patient information according to older definitions. C. Loss of all data security. D. Slower documentation in every case. The correct answer is improved communication, legibility, and data retrieval across the care team. AHRs enhance interdisciplinary communication, legibility, decision support, and data aggregation for quality improvement and research. Which is the appropriate management for a patient with an elevated potassium who takes an ACE inhibitor? A. Review potassium intake and medications since ACE inhibitors can raise potassium. B. Increase potassium foods. C. Add a potassium supplement when the condition is first identified. D. Ignore the interaction. The correct answer is review potassium intake and medications since ACE inhibitors can raise potassium. ACE inhibitors and ARBs reduce renal potassium excretion. Hyperkalemia management includes reviewing potassium intake, supplements, salt substitutes, and coordinating with the prescriber. Methotrexate is a folate antagonist. Patients on low-dose methotrexate for inflammatory disease are often prescribed A. Folic acid supplementation to reduce side effects. B. High-dose vitamin A in the majority of situations. C. Iron restriction. D. A folate-free diet. The correct answer is folic acid supplementation to reduce side effects. Folic acid supplementation reduces methotrexate's mucosal and hematologic toxicity without eliminating efficacy in inflammatory conditions. For a patient experiencing taste changes and meat aversion during chemotherapy, an appropriate strategy is to A. Offer alternative protein sources such as eggs, dairy, poultry, or legumes. B. Eliminate all protein. C. Increase spicy and acidic foods when the condition is first identified. D. Serve only very hot foods. The correct answer is offer alternative protein sources such as eggs, dairy, poultry, or legumes. When red meat tastes metallic or unpleasant, substitute milder protein sources, use plastic utensils, serve foods cold or at room temperature, and season to taste. Which is a key nutrition concern for a vegan pregnant woman? A. Ensuring adequate B12, iron, omega-3s, iodine, and vitamin D. B. Avoiding all plant protein according to older definitions. C. Eliminating whole grains. D. Restricting calories. The correct answer is ensuring adequate B12, iron, omega-3s, iodine, and vitamin D. A well-planned vegan pregnancy requires reliable source supplements of B12, iron, DHA algae, iodine, vitamin D, calcium, and zinc for maternal and fetal health. Which is the most appropriate management for a patient with dumping syndrome who has reactive hypoglycemia late dumping? A. Limit simple sugars, include protein and fiber, and eat small frequent meals. B. Consume concentrated sweets frequently. C. Drink large volumes of juice with meals based on the usual reference ranges. D. Eat 2 large meals daily. The correct answer is limit simple sugars, include protein and fiber, and eat small frequent meals. Late dumping causes reactive hypoglycemia from a rapid insulin surge, limiting rapidly absorbed carbohydrate, and balancing meals with protein and fiber prevents it. Which is the recommended approach when a patient's cultural or religious diet excludes a recommended food? A. Identify acceptable alternatives that meet the nutrition goal. B. Insist on the excluded food based on the usual reference ranges. C. Abandon the nutrition goal. D. Ignore the restriction. The correct answer is identify acceptable alternatives that meet the nutrition goal. Respecting cultural and religious dietary restrictions, the dietitian finds acceptable substitutes, for example non-pork protein, plant calcium sources that achieve the nutritional objective. Which protein intake is generally recommended after bariatric surgery to preserve lean mass? A. About 60 to 80 grams per day or more, individualized. B. 10 grams per day. C. No protein for the first month in typical situations. D. Only protein from red meat. The correct answer is about 60 to 80 grams per day or more, individualized. Adequate protein, commonly 60-80 g/day, sometimes up to 1.5 gkg. Ideal weight helps preserve lean mass during rapid weight loss after bariatric surgery. Which quality management philosophy emphasizes continuous improvement and was associated with W. Edwards Deming? A. Total quality management. B. Management by objectives. C. Theory X. D. Scientific management. The correct answer is total quality management. TQM, influenced by Deming, focuses on continuous improvement, customer focus, and employee involvement. Deming's 14 points and PDCA cycle are central. Which of the following minerals, in excess, most directly antagonizes copper absorption and can cause copper deficiency? A. Zinc. B. Calcium. C. Sodium. D. Iodine. The correct answer is zinc. High zinc intake induces metallothionein and enterocytes, which binds copper and is sloughed off, reducing copper absorption and potentially causing deficiency. Which is the appropriate approach for a patient reporting nocturnal reflux? A. Avoid eating close to bedtime and elevate the head of the bed. B. Eat a large bedtime meal. C. Lie flat immediately after eating for the general population. D. Increase late-night snacking. The correct answer is avoid eating close to bedtime and elevate the head of the bed. Nocturnal reflux improves by finishing eating 2-3 hours before lying down, elevating the head of the bed, avoiding triggers, and weight management. A ventilation hood system over cooking equipment is important because it A. Removes heat, smoke, grease, and odors and reduces fire risk. B. Cools the food. C. Sanitizes the equipment according to older definitions. D. Provides lighting only. The correct answer is removes heat, smoke, grease, and odors and reduces fire risk. Exhaust hoods capture and remove heat, grease-laden vapors, smoke, and odors, improving air quality and safety. Grease filters require regular cleaning. When should food handlers wash their hands? A. Before handling food and after any contamination such as using the restroom. B. Only at the start of the shift according to older definitions. C. Once per day. D. Only when visibly dirty. The correct answer is before handling food and after any contamination such as using the restroom. Hand washing is required before handling food and after activities that contaminate hands. Restroom, touching face, handling raw meat, taking out trash. The recommended treatment for mild hypoglycemia. The rule of 15 is to consume A. 15 grams of fast-acting carbohydrate, then recheck in 15 minutes. B. 50 grams of fat. C. 15 grams of protein only according to older definitions. D. A large high-fiber meal. The correct answer is 15 grams of fast-acting carbohydrate, then recheck in 15 minutes. Treat hypoglycemia with 15 g of rapidly absorbed carbohydrate glucose tablets, juice, recheck glucose in 15 minutes, and repeat if still low. Which is an advantage of a room service on demand model in hospitals? A. Improved patient satisfaction and reduced food waste. B. Guaranteed lower labor cost. C. No need for diet orders. D. Elimination of food safety concerns in most cases. The correct answer is improved patient satisfaction and reduced food waste. Hospital room service models let patients order when hungry, improving satisfaction and intake and reducing plate waste, though they require flexible production and staffing. How many did you get right? Let us know in the comments, and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.